You have chosen to start a treatment for your cancer that can be taken by mouth and managed at home. The purpose of this instructional video is to give you full information on the process and help you keep yourself well during your treatment. It is advisable to have the support of a friend or family while undergoing this treatment, and they might find it of benefit to watch this video as well. The amount of information to consider and the things to do can be a lot during this treatment. Your medical team will provide you with written information about your treatment. It is important that you and your friend or family member read this information carefully. Included in the information will be details about the treatment and the potential side effects it can cause. Specific instructions about the timing and how to take the medication will also be given. Cancer treatment is often referred to as cycles, representing the gap between each treatment. Typically, these cycles span between 3 to 6 weeks. While certain treatments involve continuous administration, others have breaks in the cycles when no treatment is taken. Regular blood tests are important and typically needed before each new cycle. It is a good idea to record the dates of your blood tests in your calendar and book them well ahead with your GP. There may be a delay in starting your treatment. This allows the hospital pharmacist to check the safety and accuracy of your prescription. The pharmacist will also check interactions with other medications that you are taking, including over-the-counter medications. Once the pharmacist has done all the safety checks, they will notify you by telephone call or text message when the medication is ready for delivery or collection. Once you have received your medication, you should store it safely away from children.
Looking after yourself can make a difference to how you feel whilst taking the treatment. You'll be told if there are specific activities or foods to avoid. You should try and stick to your normal routine wherever possible. Try to maintain regular eating patterns. If you're finding it hard to eat large meals, consider adding snacks in. Stay hydrated by drinking fluids, which doesn't need to be plain water. Should you experience worries about weight loss, we can refer you to a dietitian for assistance. Try to stay as physically active as you can. Engaging in gentle exercise, such as leisurely walks around the garden, can contribute positively to your well-being. Unless told otherwise, routine vaccinations such as flu and COVID-19 are safe to receive and generally recommended. Following the start of your treatment, you'll be notified of hospital appointments to monitor how you are getting on with the treatment. The frequency of these appointments will be determined by your treatment plan, and they may be in person or via telephone. Before these appointments, you may be asked to have a blood test. Cycles of treatment will then be prescribed following these appointments. It is important to tell your doctor, nurse or pharmacist if you start on any new medication so they can assess the safety of taking them alongside your treatment. Some cancer treatments may cause side effects, which require additional medications known as support medications. These are important at maintaining your well-being alongside the main cancer treatments. If you are running out of medication and do not have a scheduled hospital appointment, please kindly inform the pharmacy team with 1 week's notice. This will ensure timely replenishment of your medication supply. You may become unwell whilst having cancer treatment. You will be given our helpline details, which are available 24 hours a day. We call this the triage line. Please call this number if you have a temperature above 37.5 degrees or below 36 degrees, or if you are feeling generally unwell or have side effects from treatment that cannot be managed at home. The triage team will decide if an in-person appointment is necessary or if they can give advice over the phone. Prior to starting treatment, it is advisable to contemplate how you would handle situations in the event of an illness. Consider arrangements for getting into hospital and for the care of young children, people that you look after and pets. For non-urgent queries, you can seek the support of your clinical nurse specialists, and we would urge you to make contact with them. We have tried to make this information meet your needs. If it does not meet your individual needs or situation, please ask your healthcare team for more details or information. Should you not receive an appointment, please call the hospital on 01865 235 185.